Good evening all. Welcome to Edu Skills International. I'm Anjali Skaria. I'm an aspirant in Edu Skills International. And today we are going to discuss regarding reading part A. And first of all, I would like to thank Father and all admins for providing this great opportunity for me. And there are more aspirants, they are telling reading part A is difficult and they are not able to complete within 15 minutes. And we can just see how we can complete the reading part A within 10 minutes with the father strategies. Okay, so let's start the session. Once again, welcome to Edu Skills International. Today we are dealing with reading part A. This is OET 2.0 Occupational English Test. Okay, today we are dealing with reading subtest. And what is our expected score? That is, it should be always grade A or brand A. There should be 40 to 500. That is the score for grade A. If we think about grade B, what will happen means we will be getting only 350 to 400 or maybe below that. Then it will go to C plus C like that. If we always aim for grade A, we can just achieve 450 to 500 score, or we can achieve, okay, grade B, grade A we can achieve and we will get a good score in every modules. It's not only regarding reading part A, it's for every module, okay? Okay, as you all know, there are a connection with our physical mind and our psychological mind and brain. If we think that I already told you, if we think about getting grade A, we will stuck on with grade B. Sorry, if we think about grade B, we won't get enough score to pass the OET. Okay, so always choose to always aim for grade A. That is, in reading part A, we need to get at least 18 out of 20. There are 20 questions, so we need to get at least 18 for getting grade A in reading. Then there are 4 texts in reading. That is A, B, C, and D. There will be one theme for every part or every text of reading part A. It will be interconnected. And there are 20 questions and there will be 15 minutes. Means within 15 minutes, you need to complete 20 questions. Okay. So there is a greatest challenge or enemy, that is time. So we need to defeat the time and we need to overcome our challenge. Okay. Our expected score should be always grade A. That you should keep in your mind. And you have to be fast reading in your reading because as I already told you, 15 minutes only we have. So we need to complete the 4 texts within seconds and you need to read fast. Then there are, one of our example is, example for the text like in reading part, text A, there will be definition. Usually it will be definition or description. Then in reading part B, we can see clinical assessment. Then C, we can see complication. Then, okay, this is just an example I have told you. Don't expect that it should be there in your text when you get the exam. In each and every reading part A, the heading or content will be different. But this is an example, just we can just keep in mind. Okay. Then there are tips for getting or cracking grade A in reading part A. That is tip number 1, that is begin with a skim or scan. And general idea for questions are 1 to 7. Like from 1 to 7, we'll be like need to fill which is from which text. Okay, reading part A, B, C, or D. Just we need to mention the text. That is from 1 to 7. And tip number 2 is focus of each text. Each text we need to focus and just need to skim and scan. Then we can just go for the questions. Then tip number 3 is skim or search for clues. Those are the clues that Father is always telling for us to read and underline. It will be easy for us to identify the answer. The number one is title, then section headings, subheadings, names, numbers or percentage, then sequential expressions, frequency expressions, scale, adjectives, negative expressions, abbreviations. Those are the clues we can just underline by skimming the text. Okay. Next, there are 12 steps to crack reading part A in 10 minutes that you need to always be keep in mind. And first one is identify 4 text headings and write down in a piece of paper. That I already told you. There are like definition, clinical assessment, complication, and post-operative assessment. Okay, post-operative care. Likewise, you can just write down the main heading in the piece of in the side of your exam paper. Don't write over your answer space. Okay. Then second one is understand the relationship and sequence among the 4 text headings. That I told you, there are connections with each of the 4 texts, and you need to understand the relationship. If it is regarding any disease condition or any procedure, most of the time it will be regarding the disease condition. Okay. Then it can be like for regarding the medication too. So you need to know the connections. And tip number 3, that is skim the 4 text, highlight the clues. That those are the clues, 11 clues we have, and we just need to skim and underline the clues. Then fourth step is read the question statements, highlight the hedging words. Hedging words means those are the keywords or hedging words. We need to understand like to what we need to see the means okay, what they are asking, that we need to understand, and the main point we need to underline. And fifth point is read the question statement and match the text. We need to read the question statement, and we need to look out in from which text that is come, the answer is come. And sixth one is write down the hedging words identified in the question. That you can just use those steps while practicing. Okay, just write down the hedging words. Then seventh one is arrange the hedging words into 4 columns. That hedging words or keywords you can just arrange in 4 columns, like text A, B, C, D, and you can just arrange in 4 columns. Then eighth one is confirm 1 to 7 answer. 1 to 7 I already told you. It's just need to write from which text the answer is coming. So you need to confirm again that answers. Ninth one is locate the answers. That we are already okay. Find out from which text that is coming. Then we need to go to the text and locate the answer. 10th one is write the answers in the answer booklet. That we need to do in exam. That whatever answer we are getting, whatever is there, just copy and paste. Don't do anything. Just copy and paste whatever is there. 11th one is proofreading. Once more, you just go from 1 to 20 answers. Then 12th one is fill the self-assessment form. That self-assessment form we are giving every day. That you can just fill and send it to the father's email ID. From this steps from 6 to 12th. Okay, 6, 7, 8, 9, 10, 11, and 12. We cannot do in our exam. Okay, keep in mind, just we need to do in while practicing. That answer you need to write. Okay, that you know. Other things you just practice. No, do while practicing. Okay, I hope all of you understood those steps. Then, okay, this is the material that we are discussing today. That is necrotizing fasciitis. This is text A. Then text B, text C, and text D. Those are the text. And this is the exam material. You see, in part A, we have instructions. The same thing we will be getting in our exam. Time will be 15 minutes. Look at the 4 text, A to D, in the separate text booklet. We will be having, usually we will be having 1 booklet, and we'll be having 4 text in two side. Okay, usually we can see in same material, okay, method in our exam. Then for each question 1 to 20, look through the text A to D to find the relevant information and write down answers on the spaces provided in the question paper. In question paper itself, okay, nearby the question itself, you will be having the space to write the answer. Just fill there. Don't do anything over other than that. Okay, answer all the questions within the 15 minutes time limit. Okay, answer all the questions within the 15 minutes time limit. But we while practicing, we should achieve within 10 minutes, we should complete 20 questions. Okay, we should get 20 out of 20, and your answers should be correctly spelled. Okay, don't even any one letter or anything mistake happens, your mark will be spoiled. So just do the correct thing always. Then, okay, then we can see the question from 1 to 7. And okay, those are the questions from 8 to 40. Then 15 to 20, those are fill in the blanks. Okay, this is the complete material. Okay, so let's start our okay. Let's start. First of all, I will tell you what all are the things we need to do. As I told already, just we need to skim and scan. We may not get, okay, if you are a fast reader, okay, you can read within 1.5 minute or 1.5 minute, the 4 text you can just do, but otherwise don't follow that. Just skim and scan. Okay, whatever I have told the clues, you can just underline while seeing. Okay. First of all, we have seen the heading is necrotizing fasciitis. So just underline that. Then text, this is text A. That is, first one is necrotizing fasciitis. You can underline. Then scrotum. Those are the names. Okay? Names or percentage. I already told in clues that we need to underline scrotum, perineum, abdominal wall, extremities, progresses rapidly. Those are the time expressions and everything you can underline. Then septic shock, that's a disease condition. Then 32.2%, that is the number or percent you need to underline. Then classification, that's another heading. That is a heading. You need to understand that is a heading. Okay. Then in that column, we can see site of infection will be okay, body parts, and comorbidities types will be the disease condition. While seeing, we can understand what is that. Then pathogens will be like which bacteria or fungus or whatever it is, they will be mentioning in pathogens. If regarding that any questions happens, we can just come here and just check it. Then in bracket, polymicrobial is there, monomicrobial is there, we need to underline that. That's important. Most of the time answer will be coming from that. Then text B, we can go antibiotic as the heading. And then, sorry, in text A, when we skim and scan that, we just need to write down in the in our piece of okay, in our that question booklet is above that one, some space will be there. You can just write there itself text A, just hyphen, then description and classification. This is the main content of this text. So we can just write down and it will be easy for us. Okay. Then text B. When we go to text B, we can see the heading is antibiotic treatment. So we need to write down the treatment in the side. Okay. Then we can just underline there are many antibiotic names we can see. That if you can underline the antibiotics means because it is very easy for us to identify. So if you can underline, just underline everything. But it's not an issue, because if regarding that any question comes, we can just come here. Like example, ampicillin or ampicillin, sulbactam, then metronidazole or clindamycin, and that everything we can just underline. Then type 2 antibiotics are there. Yeah, MSSA, MRSA, that everything you need to underline, abbreviations. Okay. Then type 3, we have seen the antibiotic names are there. Then Vibrio infection, that is an infection name. Then type 4, if we go, we can see 5 days and 4 to 6 weeks. Those are the numbers or weeks that we need to underline. Okay, then let's go to text C. In there, the main thing is content is supportive care. That is the first line itself they have given. Okay, so you just need to take down that word and write in that side. Supportive care, we can underline fluid resuscitation, cardiac monitoring, aggressive wound care, adequate nutrition support, cardio, okay, catabolic state, increased caloric intake, then first 24 hours, albumin, pre-albumin, transfer in blood, urine, nitrogen, and triglycerides. Then wound care, that is most important. Wound care you can underline or just keep around, okay? Supportive care and wound care, you can just keep around. Then vacuum assisted closure, that's the abbreviation. So we need to underline. Those are the things mainly we can see in text C. And text C, D, if we go, we can say advice to give the patient before discharge. So we can just write down the patient's aftercare. Okay, that's the main content of this text, patient's aftercare. Then we can underline patient's aftercare, social services, physical therapy, then limb amputation, that's the name, body part, limb. Then that's the method, procedure also, we can underline. Remind the diabetic patient too, that we need to underline, that's a section heading, okay. Then glycated hemoglobin, HbA1c, 7% as number, then keep needles capped, clean the skin, alcohol parts, that's some material. So those things we just need to underline. We no need to read full things because if we won't get, mostly we won't get time for reading full things, so full material. So just skim and underline those keywords, okay, or clues. Then let's see that I already told you, just take and write down in the side of paper. That is text A is description and classification, text B is treatment, C is supportive care, D is patient's aftercare. By seeing this one itself, we can understand from the answer is coming from which text, that we can understand easily. So no need to go to every time, we no need to go through the text. From 1 to 7, it is very easy for us to fill with this one. Okay, so let's go to the questions. In there, it's written like questions 1 to 7. For each question 1 to 7, decide which text A, B, C, or D the information comes from. You may use any letter more than once. Okay, you may use any letter more than once, because maybe if the question 1 is one's answer is A, means maybe 2 or 3 or whatever it is, it can be, the answer can be repeated. Okay, so no need to worry about that. Then in which text can you find information about? In which text? Just we need to write the text from which text we have got the answer. Question number 1 is the drug treatment required. Here the main keyword is treatment. So the answer will be the treatment name. Okay, that we can see in text B. Okay,
text B.
Okay. Drug treatment. Yeah. Okay. So I will just give the time for you for identify the answer. Just write down in your paper itself, and at the end we can just discuss the answer. Okay. Okay. Text okay. Question number 1 I have already told you. Sorry. That is from text B. We will get the answer. Okay. Drug treatment. Because antibiotic treatment, everything is written in text B. Then second one is which parts of the body can be affected. Just write down your answer. We can discuss it later. We can just mention in the comment box which text is the answer. Okay. Before just going to the answer, we can just that father has already telling in every videos, we need to predict the answer. Okay. Predict means the answer can be like name, percentage or abbreviation, numbers, whatever it is, we just need to predict. Then it will be easy for us to identify the answer. Which parts of the body can be affected means the body part will be the name. Okay. Okay. Most of the members are telling text A. The answer is okay. The answer we can get from text A itself. Okay. Then the third one is okay. The various ways calories can be introduced. In that keyword is calories. Okay, calories is the keyword. So we need to identify from various which are the ways the calories can be introduced. From which text we have seen the calories. You can just mention. Then fourth one, who to contact to help the patient after they leave hospital. Here, the keyword is after they leave hospital. There are synonyms they will be using. Okay, we just need to understand that synonyms also. Then paraphrasing, everything is there. We need to understand. Okay. After they leave hospital, that's the keyword. Fifth one is what kind of dressing to use. Okay, kind of dressing or type of dressing. Kind of dressing is the keyword. Then sixth one is how long to give drug therapy to the patient. Here, drug therapy is the keyword. Drug therapy means drug treatment. That's synonyms we need to know. Okay. Okay. More members are telling B. Next one is seventh one. What advice to give the patient regarding needle use? Advice and needle use. Those are the keywords. Okay, we can just go to the next one. Okay, question number, we can just see what's the answer. Okay, question number 1 is from the text B, drug treatment. Okay, that we already written to write in the separate the treatment. So it's very easy for us to identify. No need to go to the text itself. We just while seeing that heading itself, we can understand. Okay. There are many treatments, antibiotics names, everything they have given. In second one is text A, parts of the body parts they have written in text A itself. We already underlined scrotum, perineum, abdomen, and everything we are underlined. So it's easy for us to identify. Okay. Then most of the from description itself, we will get the part of the body parts. Okay, body parts affected, everything. It will be from the description that we need to know. Then third one is the various ways calories can be introduced. Okay, calories, everything is written in the supportive care. So in the supportive care, we can see the catabolic state and required increased caloric intake to combat infection. Okay, increased caloric intake is needed. Everything is written in text C. Then fourth one is who to contact to help the patient after they leave hospital. After they leave hospital means which one? In text D they are given after after discharge the patient what need to do the patient need to do which are the things, everything they have written in text D. Advice to give the patient before discharge means whatever after discharge they need to do, everything is written in text D. That's a synonym you need to understand. Remind the diabetic patient do everything they have written in there itself. Physical therapy, everything. Okay. Then fifth one is what kind of dressing to use. That we have seen in the text C itself, because wound care is the advanced wound dressing, everything they have written in text C. Okay, in that wound care itself, the dressing will come. That we need to think and we need to understand. Okay. Then sixth one is how long to give drug therapy to the patient. Drug therapy means antibiotic therapy. Okay. That same we have seen in text B. How long means 4 to 6 weeks. That we already underlined the number. Okay. In that down one type 4. In that we can say 4 to 6 weeks. That's the answer. So we just need to write B. Okay. Text B. And seventh one is what advice to give the patient regarding needle use. Advices for needle use. Everything is given in text D. Remind the diabetic patient to what? Keep needles capped until use and not to reuse needles. Advice is given in text D. So just write D. So we got 7 marks. Then let's go to the 8th one. Which two? Okay, in that 8th one, they have written like answer each of the questions 8 to 14 with a word or short phrase from one of the texts. Each answer may include words, numbers, or both. Okay, words, numbers, or both can be included. It can include percentage too also. Then question number 8, that is, which two drugs can you use to treat the Clostridium species of pathogens? Here, keywords are or hedging words are two drugs and treat. Okay. First of all, we just need to predict what will be the answer. Which two drugs means what? The answer can be drug name. Okay, drug name can be the answer. That we just need to predict. Then second step is to know from which text they have written the drug names. Okay, then we just need to go to the text and identify the answer. Okay, the 8th one is clindamycin and penicillin. Okay, now we can see in treatment itself, antibiotic treatment, they have written clindamycin and penicillin in type 3. Okay, so we just need to take down and write in that space. Okay. Then 9th question is, which common metabolic condition may occur with the NF? Here, metabolic condition is the main hedging word. So we need to look out metabolic condition from where we have seen the condition. What is metabolic condition? We have seen from text A, we can see in that column comorbidities or types in there. The metabolic condition, there is only one metabolic condition they have written, that is diabetes mellitus. Just write down the diabetes mellitus in your answer space. Okay, that's enough. No need to write the text. Okay, just write the diabetes mellitus. That is enough. Okay, 10th one is, what complication can a patient suffer from if NF isn't treated quickly enough? Here, keywords are complication and isn't treated. Okay, those are the keywords. That complication we can see in text A, that is septic shock. Okay, the infection progresses rapidly and septic shock may ensue. Hence, the mortality rate is high. Okay, so septic shock is the complication that we can just write down in that 10th answer space. Okay. Then 11th one is, what procedure can you use with a wound if the patient can't be operated on? Then the answer will be the procedure name that we can see in text C. The procedure name they have written. We have already underlined that one, vacuum assisted closure, V or VAC. Okay. Either you can write VAC or you can write vacuum assisted closure. Whatever hyphen is there, everything you just need to write same like whatever they have written. Just write the same thing. Don't remove any hyphen or anything. Okay. Okay. 11th one we okay. 11th one. Okay. 12th one. What should the patient be told to use to clean the injection site? Here, keywords are patient be told and clean an injection site. So there will be one material. We can just predict. It can be the material that we can see in text D. Whatever advices they are given in there, clean the skin thoroughly before blood glucose testing or insulin injection, and to use alcohol pads to clean the area afterward. What? Use alcohol pads. So just need to write alcohol pads. Okay. Write that S also. Okay. Don't remove that. Then 13th one is, which two drugs can be used if you can't use vancomycin? Here, the answer will be drug name. Okay, we can just predict. Then if you can't use vancomycin, that we can see in antibiotic where treatment, text B, MRSA tends to be covered by vancomycin or daptomycin and linezolid in cases where Streptococcus. Okay, Staphylococcus aureus is resistant to vancomycin. Resistant means what? If we can't use. Okay, that's the synonym. Resistant means can't use. So we just need to write naptomycin and okay, linezolid. Okay. Then 14th one is what kind of infection should you use tetracyclines for? Here kind of infection and tetracyclines, those are the keywords. We just need to underline and need to see. Okay. In treatment, we can see if Vibrio infection is suspected, the early use of tetracyclines, okay, included doxycycline and monocyclines and third generation cephalosporins. Okay. So the answer is Vibrio infection, that we can see and we can just take down and write in that 14th answer space. Okay. Either you can write Vibrio or you can write Vibrio infection. Okay, any of that is correct. 15th one is the average proportion of patients who die as a result of contracting NFEs. This from 15 to 20th, what means complete the each of the sentences 15 to 20 with a word or short phrases from one of the text. Each answer may include words, numbers, or both. Okay, we just need to fill the blank. So the answer will be the average proportion means what we need to look. We need to look the percent. Okay, proportion means there will be a number or percentage. So from text A, we can see they have written 32.2%. There we can see, okay, septic shock may ensure. Hence, the mortality rate is high. Median mortality 32.2%. So, mortality rate means what? Death rate. Okay, die means death. Death is equal to mortality. So, that we all know. So, we just need to write down that answer. 32.2% we need to take down and write. 16th one is patients who have eaten seafood may be infected with Aeromonas hydrophilia. Here, eaten and infected with Aeromonas hydrophilia. Those are the keywords we need to underline. Patient who have eaten means there will be one food item name. Okay, we need to predict that. And we can see that in text A. There they have seen Aeromonas hydrophilia. In pathogens, we can see that name, pathogen name we can see. Then in that they have written seafood. Okay, consumption for Aeromonas. They have written clearly. So when we eat seafood, the condition happens. Okay. So just we need to write seafood. 17th one is patients with a type 2 infection usually present with infected diet. Okay. So keyword is type 2 infection. Okay. Types we have seen in text A. Then we need to predict the answer can be the body part. Then in text A, we have already seen that 4 headings are there: microbial, okay, microbiological, pathogens, site of infection, and comorbidities type. Here, site of infection is body parts. There we can see type 2 monomicrobial, that is affected in which part? Limbs. It is affected to our limbs. So just write limbs as an answer. 18th one is type 1 NF is also known as dash. Okay, type 1 types we have seen in text A itself. There type 1 in bracket they have written, that is another name that we need to understand. Then we need to write polymicrobial. That's the answer. Just take and write the answer in that space. 19th one is the patient needs to be aware of the need to keep glycated hemoglobin levels lower than that dash. Okay, lower than dash means what? There will be something number. Okay, number can be there. So that we need to predict and we need to we can go to the text D, because whatever for the diabetic patient, everything remain to diabetic patient. That is written in text D that we already seen, and we can just go to the number. Directly go to the number. Keeping the glycated hemoglobin level to 7% or less. Why we are not writing this 7% or less means that already is there in what in text. Okay, sorry, in question they have already written lower than. Lower than means that's a synonym for less. So they have already written the lower than. So we no need to double write. Okay, we no need to repeat the same word, whatever they have written in questions. That always should keep in mind, because if we write repeatedly writing the same word or number or whatever it is, it will be losing our mark. We won't get the mark. Never ever get the mark. Even if we write the percent, okay, if we repeated the percent, then also we won't get the mark. So just be careful for that. Okay, so just need to write 7%. Then 21 we can go. Okay. The patient will need a course of dash to regain fitness levels after returning home. Here keyword is after returning home. That we have seen the advice to give the patient before discharge. That is the advices. What they have given, we can see in there. Okay. And physical therapy sessions to help rebuild strength and promote the return to optimal physical health. Okay, so we have seen the answer as which therapy? Physiotherapy. Physiotherapy we need to give to the patient for regain fitness. Regain fitness means rebuild strength. That's a synonym. Okay, we need to understand and we need to write down physical therapy. There are other therapies they have written, but don't confuse with that. Just see the synonyms. Okay, rebuild strength and promote the return to optimal physical health. That's a synonym for, or paraphrasing for the rebuild. Okay, for the regain fitness. Okay, we just need to know the answer as physical therapy. Just write down that physical therapy in our space. Okay, I hope all of you understood what I have explained. Then once again, thank you all. And then once again, I would like to tell you that don't repeat the whatever words or percentage or number, whatever they have written in question. Don't repeat the same thing in your answer, whatever we are writing the space. And wherever we are writing the space, don't write down anything else on, or even one full stop or anything can be lose your mark. So just don't write anything else in the space of wherever you need to write the answer. Okay, then again you need to confirm the answer. Just go again from 1 to 20 and just confirm your answer. Okay, so you will get the 20 marks within 10 minutes. Likewise, you need to repeat this full steps. You need to repeat continuously. Then you can achieve the full marks.